every shade of blue and green, every breath of air, yeah. All of this has always been and may always be there. Do you care?
To answer the songwriter, yes, the Canadian Friends of Hôpital Albert Schweitzer, Haiti, do care. And so do countless other Canadians, Americans, and Europeans, not to mention the amazing people who work at the hospital. Hôpital Albert Schweitzer, affectionately anagrammed as HAS, is a beacon of light and hope in the Artibonite Valley throughout Haiti and beyond. Doctors from all over the world come to work at the hospital. It's the kind of place where doctors come to remember why they became doctors. International specialists bring their areas of expertise to the hospital and also help in the training of Haitian staff. Hôpital Albert Schweitzer began with a dream. In 1947, Larry Mellon read an article about Dr. Schweitzer's work in Africa. That article, and communications with the legendary medical missionary, changed Larry and Gwen Mellon's life forever. It inspired them to build a hospital in central Haiti using Schweitzer's philosophy, reverence for life. HAS is a model for healthcare facilities in developing countries around the world. An integrated rural health system, HAS provides medical care and community health and development programs for more than 300,000 impoverished people in the Artibonite Valley of central Haiti. The main concerns for Hôpital Albert Schweitzer remain HIV/AIDS, malaria, tuberculosis, malnutrition, and maternal care. These concerns are addressed by the three prongs of HAS: the hospital, community health, and community development.
Every breath of air, yeah. All of this has always been and may always be there. Do you care?
From the beginning, Gwen and Larry Mellon established a practice of providing training and advancement to local residents as a key to the hospital's success. Currently, 98% of staff is Haitian. The nursing department initially consisted of women from the US, Canada, and Europe, but it is now 100% Haitian. The staff continues to follow the Mellons' example of caring. I would like to introduce you to Saintha, who says she's about 50 years old, but she's not really sure. Still young by our standards, she looks much older. Life is hard for a subsistence farmer's wife in the Artibonite Valley, but changes over the years have gradually made life easier. One change that has had a dramatic effect on Saintha's family is the offering of quality primary care in 7 clinics, even in the mountains. In addition to solving the problem of overcrowding at the hospital, most of the residents of the Artibonite Valley now live much closer to medical care. When Saintha was born, her mother had to trek down the mountain for a day and a half to reach the then new hospital in Deschapelles. But now Saintha can take her family to the local clinic in Bastion, just a few hours away. Getting to the clinics in the mountains is a real challenge for HAS staff and their 4-wheel drive vehicles. Haitians also find the trip to the clinics difficult as they thread their way along narrow trails on foot or on the back of a horse or donkey. In 2006, more than 120,000 visits were recorded at clinics staffed by people who care. Since curing the sick is only half the battle, HAS also fights the causes of disease. In the 1960s, for example, an HAS program wiped out neonatal tetanus, which had killed hundreds of our Tibanite Valley infants every year. Since the main focus for the Canadian Friends of HAS is maternal and child health, everything related to safe deliveries and follow-ups is of special interest. A growing number of women now use contraceptive methods, while most pregnant women in the HAS district get prenatal checkups and birthing instructions. To date, over 35,000 sterile birthing kits have been assembled by caring Hamiltonians and sent down to HAS. Beyond the 7 major clinics, there are mobile clinics that take medicine even closer to the people. Mothers keep a record of the immunizations their children receive at sites like this one in the mountains. While this mobile clinic is very rustic in appearance, it is highly effective. Last year, 76% of children under 12 months of age were immunized. The root causes of the diseases HAS treats are economic. Farmers on the steep, deforested mountain slopes cannot grow enough food to feed their families, and they aren't strong enough to resist tuberculosis, typhoid, and other common ailments. HAS community development programs make a huge difference in the lives of families like Saintha's in many ways. Caring HAS staff and volunteers built a latrine shared by 5 families in Saintha's compound, dug a safe well only half a mile away, and provided an inexpensive filter to purify bad water when heavy rains make the trail to the well impassable. Veterinary support and teaching about animal husbandry help Haitians manage their livestock assets. An important ongoing project is the planting of diverse trees in various communities in the valley. The project is very much a partnership. HAS provides supplies and education in planting trees, while farmers in turn are expected to care for them until they reach maturity. This two-way street bodes well for the future because the Haitian people are taking ownership of the improvements. Another important initiative that attempts to point Haitians toward a better future is the Adult Literacy Program. For over 50 years, people's gifts have saved and changed the lives of people like Saintha. All parents have hopes for themselves and their children, but in Haiti, parents labor every day of their lives under the most difficult circumstances. They know that without HAS and without the countless caring people in the world who support them, life would be considerably worse. We can inspire others with our stories about the work of the hospital. Most first-timers in Haiti made the plunge because they were intrigued by the passion of a friend who had already been there. One of the best examples of an inspirer is Debbie Berquist-Jules, who went to Haiti as a nurse about 15 years ago and stayed.
And I am so proud that Hamiltonians are the first group of Canadians that are really taking strong interest and making great efforts and making others in Hamilton, Ontario, and Canada know of Hôpital Albert Schweitzer and the work we're doing, and to help do fundraising, which is so important for us to be able to keep on our mission of helping the people of the Tibanite Valley.
Debbie's emotional appreciation is a response to what the Spectator calls Hamilton's heart for Haiti. It is easy for us to be touched by people who are so resourceful, living in very difficult circumstances, but managing to stay positive nonetheless. As we listen to the song, Do You Care?, we think about the lives, like Saintha's, we are changing by our efforts for Haiti. We can show we care.